A reminder.
Okay, great. Thanks. All right. Good evening, everyone, and thank you very much for joining us. As Rob just mentioned, my name is Jennifer Cornell, Director of Long-Term Care for the County of Grey, 3 long-term care homes, Grey Gables, Lee Manor, and Rockwood Terrace. We met last virtually on January 6th, and the purpose for our call tonight is to provide an update on the changes released by the Ministry of Long-Term Care recently, and to provide an update on the outbreaks and the situation related to COVID. I'd like to do a quick overview of the protective strategies that continue to be in place. So active screening is still required for every person who's coming in and out of the building. That includes the questions that are asked at the door, as well as rapid antigen testing for all staff, visitors, when visitors are permitted, designated care partners, and that's every day or shift or visit. So every time someone's coming in, you're doing a rapid antigen test. All staff and designated care partners are wearing N95 masks and eye protection. Often it's the cool shades, unless it's in an outbreak area, and then it's a face shield. And additional PPE, face shields, gowns, etc., are being worn when the risk assessment or conditions warrant. Since we last met, we have continued to see a significant surge of COVID cases, both provincially and locally. Unfortunately, with this surge, we are seeing more and more long-term care homes in outbreak. Today, the Ministry of Long-Term Care is reporting 256 long-term care homes in confirmed outbreak, and this number actually represents a decline, which is good news. At the peak of this wave, more than 400 long-term care homes were in active COVID outbreak. The ministry released updated directives for long-term care on February 4th, with a phased-in approach to easing restrictions in long-term care. So in this update, I'll do an overview of the outbreak status of all 3 homes, go over those gradual easing of restrictions, just refresh the outbreak protocols compared to eased restrictions. So what happens when? Have a quick check-in on vaccines and also a quick check-in on communication. So right to outbreaks. On December 22nd, Rockwood Terrace was confirmed to be in COVID outbreak. Karen Kraus and her team have done an amazing job of managing this outbreak. While this has gone on for some time, it is not a reflection of how the team managed. What it actually reflects is a very well contained outbreak with minimal spread of infection. Only 27 out of the 100 residents tested positive. 9 out of 130 staff tested positive linked to the outbreak, and a total of 17 staff tested positive, which adds in individuals who acquired the infection not related to the outbreak. There were many challenges faced throughout the past number of weeks in managing the outbreak. It happened right over the Christmas holidays. There were a number of staff unable to work due to being high-risk contacts of family members, etc. Kids went back to school. Both variants, Delta and Omicron, were identified as being present and part of the outbreak. Sadly, 2 residents passed away due to COVID. And finally, the turnaround time for test results was a really big challenge. Having said that, there have been silver linings and opportunities for us to notice and celebrate some really good achievements. So every team member stepped up and gave their very best and more to support residents and their colleagues. Really wonderful support from our partners in paramedic services, support and direction from our partners at Grey Bruce Public Health, as well as Public Health Ontario, and resourceful, innovative, and outside-the-box thinking all through the outbreak. Setting up of the auditorium as a dedicated COVID care unit, finding staff putting up their hands to say they would work in that special unit. Designated care partners provided even more support and hands-on help throughout the outbreak. And finally, some really innovative ideas around how to increase the testing time to have a much faster turnaround for test results. And the team is in the process of being educated and setting up an ID Now machine. And so I won't get into all the clinical details because I won't be able to, but the ID Now is a test system that is better than a rapid antigen test, not quite as good as a PCR. It's a molecular test, so it's still a swab, but it's processed right on site and the results come within 15 minutes. So our partners, the paramedic team and public health, are working with Denna and the Rockwood team to get that set up. And we're really hoping that this will help down the road as we work our way through the next phases of COVID. And finally, if there are no more positive cases overnight, the outbreak at Rockwood Terrace will be declared over tomorrow, Friday, February 11th. So stay tuned for that update. If it doesn't happen, that's okay too. We'll manage, but we're really hoping that we are able to close the door on that. The Lee Manor team has also done an excellent job managing outbreaks in 2 different home areas. The One South team successfully managed and contained a COVID outbreak, which was declared over by public health on February 7th. And on 3 North, there's a seasonal coronavirus, common cold, and it's also being managed really well. And if things continue as they have been, we can expect that outbreak to be declared over on Monday. Grey Gables has also been managing a COVID outbreak on Maple Lane since Saturday, February the 5th. Unfortunately, 1 resident passed away with COVID on Saturday. As of today, there are 5 residents who have tested positive, 2 staff positive cases linked with the outbreak, and 2 staff cases determined by public health to have acquired their infection in the community and therefore not linked with the outbreak. All residents and staff of Maple Lane will have PCR testing again tomorrow, which is Friday. All residents on Maple Lane continue to isolate in their rooms and are having in-room meal service. So that's the update on outbreaks, and I'm going to move into the update that came on February 4th from the Ministry of Long-Term Care. So based on some encouraging public health and healthcare indicators, the ministry announced on February 4th a plan to gradually lift temporary measures currently in place in long-term care. As of February 7th, residents who have received at least 3 COVID-19 vaccine doses are able to resume social day absences. And these changes apply only to home areas and homes that are not currently in suspect or confirmed outbreak. So to arrange a social outing, please contact the home to speak with the registered nurse. As we did previously when social absences, there was a process for social absences before Christmas, you'll call to make the arrangements, we'll talk about the plans, assist with a risk assessment, and work out the details. Anyone who will be in the vehicle with the resident is required to do a rapid test at the home prior to the outing. Masks are to be worn at all times, and if tolerated by residents as well. And we'll also remind you of the public health measures that are in place. So masking, hand washing, and keeping distance, staying away from crowds. In addition to the resumption of social outings, residents may now also designate up to a maximum of 4 family caregivers. So we call them designated care partners, unless they were designated before December 15th. So currently, only 2 designated family caregivers may visit a resident at one time in areas that are not in outbreak. So to arrange additional DCPs, please contact the Resident Family Services Manager. That's Terry, Kim, or Elena at the appropriate home. And a reminder that it's the resident's decision as to who they designate, and if they're unable to cognitively make that decision, it becomes the decision of the power of attorney. In addition to that, the ministry outlined some targets that we can look forward to, but I caution that they are targets, so it's not a definite. So targeting for February 21st, we would welcome general visitors 5 years and older who have had at least 2 COVID-19 vaccine doses. During this period, February 20 up until and beyond February 21st, children under 5 may not visit the home at this time unless they are 12 months or younger. We will also be hoping to increase visitor limits to a maximum of 3 people per resident at a time, including the designated care partners. And social day absences will be expanded to include residents that are not vaccinated or have not completed their full vaccination. In addition, the hope is that overnight social absences will also resume for residents that have had at least 3 doses. They also talk about what will happen March 14th, and that the hope is that general visitors under the age of 5, so no vaccination requirements, will be permitted, increase the visitor limit to 4 people per resident, including the DCPs, and resume social overnight absences for all residents regardless of vaccination status. As I said, though, those are our targets, and so we'll keep you posted if things change. I do believe that, and I might say this more than once, everyone is done with COVID, but COVID I don't think is quite done with us. So we need to stay the course, and we need to make sure we have protective measures in place. So I just want to go over what will happen if a home area or a home is put into suspect or confirmed outbreak, which is declared by public health. So if that happens, we'll do our communication. We'll make sure that you know. All resident outings will be suspended. General visits, if they're permitted, will be suspended. Essential visitors will always be permitted. That's for residents that are palliative or critically ill. And DCP visits will be reduced to 1 DCP in the room at a time. We will still do virtual visits, arrange visits, and if there are home areas that are not an outbreak, we will still arrange window visits. And just an important reminder as we figure out this transition with the easing of restrictions, if you're a DCP or when permitted a general visitor and you become ill or test positive and you've been in the home recently, give the home a call and let them know. It really helps us to work to contain and to respond really quickly. So we'll do an assessment with the person that you were visiting. We, depending on the circumstances, we may do a rapid test or an ID Now test or a PCR. So let's talk a little bit about vaccine boosters and 4th doses. So I might see if I can share my screen because I tried to write this out, and the chart, it's a chart because it's seemingly become kind of complicated. So what we'll do is we'll share this chart in the follow-up email. Okay, so I think you can see my screen. So this is the chart. There has been a change. This actually arrived at some point today. So this is very fresh and hot off the press. So this is the proof that is required. This column is staff, support workers, placement volunteers. This column is caregivers, which is a designated care partners, and general visitors when they're permitted. So staff, so for first dose or medical exemption, all staff and students are required, as well as DCPs. Second, fully vaccinated, which is 2 doses, currently required for all staff. For DCPs, this is required by February 21st, and there was a time frame that matched with that for the first dose. So DCPs should have their second dose by February 21st, proof of a 3rd dose. So staff, for anybody that was eligible after, that was eligible before March 14th, they must provide proof by March 14th or within 30 days following the recommended interval if they have had COVID. And it's the same for caregivers. And General visitors are still required to have 2 doses. That's what's considered fully vaccinated. It is not required for general visitors to have proof of a 3rd dose at this time. So I know that's clear as mud. We will share the chart with the follow-up email. All residents of long-term care homes are eligible for a 4th dose of mRNA vaccine if it's been at least 3 months since their 3rd dose. And so we do continue to provide that vaccine, to get consent and provide that vaccination for residents as they become eligible. And finally, I wanted to check in about communication. I committed early on in this pandemic to provide timely and transparent information and communication. During the COVID outbreaks, we've provided daily updates. The response from this has been very positive. As this surge, though, begins to decline, and we are all becoming more comfortable and more familiar with the outbreak process and outbreak management, I would like to move the updates to come out on Tuesdays and Fridays, or anytime there's a significant change. I'd like to try this for a week or so. If you feel strongly about this, that this change isn't meeting your needs, please let me know. Send an email to the communications email. My email is also included in the emails that come out. So just let me know if you feel strongly that this isn't working for you. So that is a lot of information. Thank you very much for your patience. We will get to your questions. I did want to add that there is also a slide deck that I'm going to attach with the follow-up email, and it's put out by the Science Table, the Ontario Science Table, and it's supporting long-term care home residents during Omicron. And it's 7 slides, and I thought it was really informative. So we will share that out as well in the follow-up email. So we can go to questions now.
Very good. That was excellent, Jen. Thank you very much. So we do have a few in there to get us started, but if you have any questions for us tonight, please do enter those in the Q&A and we will get to those. The first one is around rapid testing for staff at the homes. Can you explain why staff do not wait for a rapid test result before carrying on into the home?
Sure. So they do have to wait to have their rapid test read before they can do any direct care. So part of it is there's a lot of challenges with everyone rapid testing at the same time. So we need to have flow. We need to make sure that staff have time to report appropriately and hear from the previous shift. So they come in, and the other thing is that the rapid test kits actually changed and are a little bit more time consuming right now. There was a big supply of one brand, and they take a little bit longer to do the testing and mixing piece than the previous batch of tests that had come. So they come in, they do their rapid test, they're all labeled, there's someone overseeing the testing area. They go to their floor to where they're reporting for work. They do not do any direct care until they've received the go-ahead from the screening oversight person. And so they should not be doing any direct care until they know for sure that they're good to go.
Great, thank you for that explanation. The next question is regarding staffing levels at the home. Why is Rockwood short-staffed if there are 130 staff? It's been horrible for nurses, PSWs, residents, as well as DCPs. Can you share any insight into some of the challenges around staffing a home in an outbreak?
Sure, and it's a good question, and it's true. I think I need to agree and acknowledge that it has been really difficult, and working shorthanded at the best of times is less than ideal and difficult, but working shorthanded in an outbreak is particularly challenging. So while there's 130 staff, that does cover all of the different departments. And I forget what my number was in terms of how many actually were tested positive with COVID. So that number of people were off-site isolating and following the protocols. But there are also a number of staff affected by high-risk contact protocols. So perhaps someone living in their house had COVID, or they had some exposure in some other situation. And we're not alone in that. That is a challenge that employers across the province and probably the world are facing.
Thank you. This question is about laundry and the time frame that it's taking to get back to residents. I'm not sure if it's home specific, but do we have any insight on the timelines for laundry and why that may be taking longer right now, related to staffing, perhaps?
Perhaps. I actually don't. I would recommend that this person reach out to the home and talk to the environmental supervisor, and talk about the specifics. I think it's worrisome, and it's a specific question about things missing or not getting back to someone. So let us have a chance to dig into that. Generally, laundry, the turnaround in normal circumstances is 48 hours. So that will be strained, though, when all hands are on deck supporting in-room meal service, when people are being redeployed to support in other areas. So it may be longer in some circumstances, but if there's something specific, it's better to get the details now so we can get our investigation going and see where we can find them.
Okay, thank you. Do we have any insight into the severity of COVID-19 and how it affected the residents at Rockwood Terrace?
Sure, we do. And I will also maybe turn to Dena to give some more specifics, but we compared to the first two waves where we saw the tragedy that unfolded in long-term care, we had all long-term care homes in the province had a much better experience and outcomes in this surge. We have so much to be fortunate for. We have vaccinations and people fully vaccinated. We have a much better understanding of how COVID spreads and how to contain it. We have accessible PPE. So I don't know if you remember pictures coming out of New York where people were using garbage bags and coffee filters. We didn't have that. Having said that, the people that live in our homes are very frail and vulnerable, and have lots of challenges that make COVID, and when there are symptoms, can make it more challenging. So we know that 2 residents did pass away at Rockwood. And on the other hand, we had a number of residents that tested positive that had no symptoms at all. And in fact, that made it in some ways challenging to keep people isolated to their rooms because they weren't feeling unwell. And then we had some that had really mild symptoms in between. So part of the unknown, though, is that we know we had Omicron and we know we had Delta, but we don't know who had what. That's not the information that comes to us. So I don't know, Dena, do you want to add anything?
Yeah, I think as it relates specifically to that question, in terms of how serious the residents had COVID, I think, every individual is unique that come along with their comorbidities. And I know the province is looking, did somebody die from COVID or die with COVID? And those are certainly healthcare issues that we work with the families. But what I can say, and Jen certainly alluded to it, that we had a wide spectrum, but that weren't very well at all and being managed. And we were really fortunate. Dr. Pillish has attended every outbreak management meeting, attended the home, great monitoring. Everybody's health status was reported on daily. But also on that other continuum, as Jen alluded to, where they are asymptomatic, thankful for the vaccination approach. So we were definitely really fortunate with many residents doing very well and recovering in rather quick ways. Unfortunately, again, alluding to the length of the Rockwood outbreak, the protocols where they had to be isolated for 14 days have now changed to 10 days throughout this outbreak. So you may hear that a resident came out of outbreak or out of isolation or certainly recovered quicker, but that may not necessarily have been the status of their well-being, but rather the previous outcome of 14 days has now been shortened to 10 days based on government guidance within the same outbreak. So if you were watching some of that data, that might have, if you still hear some people were in or someone was in longer than another, it could very well have been related to the requirements that were set.
Okay, thank you both. Jennifer, can you clarify when general vaccinated visitors will be allowed back into the home?
Yeah, that's a really good question, and I'm glad you asked it, Katrina. We were talking today about how many iterations of visiting guidelines have there been, and I didn't go back to look, but it's more than 2. Like we must be on 13 or something by now. So then, as of the new guidelines, it's actually general visitors, vaccinated general visitors is February 21st. Is the target date. So February 21st, general visitors that are fully vaccinated are able to go into a home as long as it's not an outbreak or suspect outbreak.
Perfect, thank you. Will we be keeping the auditorium at Rockwood Terrace set up for COVID patients? That did seem to be the best way to contain the spread.
Yeah, I think that we will. We're going to do a gradual easing. We've talked about turning up the dial and turning down the dial. So we're going to take a very cautious approach. We're in a significant transition period and Dana mentioned that. So the outbreak protocols that public health uses to guide long-term care homes and retirement homes have been recently updated, and we're still a little bit in between the 2 versions. So all of the organizations are figuring out what does the new version look like and how will that be. So we want to be prepared that if we go into suspect outbreak or we're in a situation where we want to act quickly, we want to have the ability to do that, to act as quickly as we can. So we'll leave the auditorium ready to go for a period of time. And the team did an amazing job at getting that ready and turned around. And it may have felt like a long time from the outside looking in, but once we were able to determine that was the way to go, we were able to have a consult with our local public health associate medical officer of health, as well as Public Health Ontario provided a consult with us to just help guide us. So yes, long answer for yes, we're going to leave it set up.
That's okay. Are staff who test positive still required to be off for 14 days?
So that is another good question, and I saw that someone sent me a friend sent me a text. So long-term care protocol is 10 days. And there was a lot of confusion about this, and there still is a lot of confusion. So even some of our designated care partners who have tested positive and they are being contacted by public health, if there's some confusion that they're linked with a long-term care home, they might be told, oh, you need to isolate for 5 days, but actually they can't return into the home for 10 days. So staff or DCPs that test positive are required to be away for 10 days, not the 5.
And if I can add just to that, Jen, it's 10 days from symptom onset or your PCR. So if you do have a positive, if you're a designated care partner and you have a positive rapid antigen test, we do want a confirmatory PCR, and we can accommodate that at the home. We're getting very quick testing turnaround times, but we definitely need to see that it is confirmed, and then we count the 10 days from either your symptom onset or positive result, whichever is less. And then when you come into the home, if you did test positive, we wouldn't rapid antigen for 30 days. So we wouldn't do that rapid test. And that's really important that we need to communicate that. And if we do see a positive PCR test, we have it on the list and everything's good. And sort of no questions about when to start.
Thank you. This is a comment from one of our attendees tonight. I really want to thank all the employees at Grey Gables. You've been wonderful in your communication, and my mom is one that has tested positive, and we feel so confident that you're doing all you can to keep all the residents safe. Kudos and hats off to everyone during these stressful times. Thank you very much for that comment. That's very, very much appreciated, and I hope we have some staff from Grey Gables on the call here tonight as well. We will pass that along.
Yeah, we will. I really appreciate the comments, and there's this disconnect feeling for, I think, lots of us working in healthcare, where the world is done with COVID and looking to ease restrictions and change things, and the residents and the staff and the teams are still living very much in COVID outbreak protocols and preparation and prevention. So I did see something somewhere changing the words of restriction to protection. So I'm going to try to do that and change the language. So when we think of them as restrictions, it feels really not very nice. But when we think of them as protection measures, protective measures, it just feels a little bit better. But everybody's getting tired. And so these comments and really nice comments like this are really rejuvenating and motivating. So thanks for passing them on.
All right, this one might be for you, Denna. The N95 masks at Lee Manor are very uncomfortable and cause deep marks and tiny blisters to the face. I know there are more comfortable N95 masks that don't cause discomfort, that don't have to be fitted. Are there different kinds that we could look into?
I think there absolutely is different kinds that we can look into. And I'm assuming this is for one of our designated care partners coming in. And we wanted to provide, the best protection, particularly as our home was in, 2 of our units were in outbreak recently. So we definitely want to protect the whole community, our long-term care community, as well as our community as our designated care partners leave. But we did have some supply, so if people had their own N95s, and if that was available, but we certainly wanted to provide the N95. And again, if there are those KN95s for our designated care partners to be able to wear with a tight seal, recognizing it's comfortable, do their seal check. If they're coming in from outside, particularly a snowy day, we definitely want a clean one. But at the end of the day, it is the protection that we're looking for to support our residents.
Great. Thank you.
And we may be using a different supply. We may be running out of that supply too. So don't be surprised, because those are the ones that we've had provided to us. But I'm just seeing a note that there might be a small amount left, and we may be looking to another supply. But I appreciate that feedback, and we're certainly open to. We don't want people to have blisters on their face. So if that's a problem, reach out to the RFSM or Tolene and Susan, Stacy at Lee Manor. We certainly want to be supportive.
All right, thank you. And that is Resident Family Service Manager, I do believe. What mental health support is provided to residents and families? Is there anything available during lockdown periods?
There is. So each home has a contracted social worker that is on site. The amount of time that they're on site depends on the size of the home, but reach out to the Resident Family Services Manager, so Elena, Kim, or Terry, and they will help get you connected with the social worker for those services. I am very conscious of needing to figure out how we provide some mental health and well-being support for residents, families, and team members in the days, months, and years following the pandemic. It's something that's on my mind a lot. I don't have a solution, but so if people have suggestions, but I think it's something we need to intentionally be thinking about and planning for.
Okay. Once the outbreak is over, would you consider smaller groups for dining? Example, fewer people in the dining table at the dining table.
Yes, so I will check in with Karen that we talked briefly about the de-escalation. That's the terminology we've been using as we ramp down from outbreak measures, and talking very intentionally about what are the de-escalation processes. And we talked briefly about what dining would look like in the new post-outbreak, and it won't be back to normal. It will still be supporting that cohorting as best we can. So we try to have roommates sitting with roommates at the dinner table, to support the space, trying to have people spaced out. So yes, we will be considering all of those protective measures so that we can stay out of outbreak.
With no COVID cases in Lee Manor, do we still have to wear N95 masks and goggles?
Yeah, so this is a good question, and we have talked about this a lot. So there's a lot going on. We talk about the dialing down and the dialing up. So we are dialing down some restrictions in terms of and introducing more people in and out of the homes. And so what we do plan to continue with the protective measures that we know we can manage, and kind of as our common denominator, what can we control? And what we can control is the screening, the testing, and the level of PPE. So N95 and the cool shades, which I wish I had a pair to show you, but you'll have seen them. They're the ones with the colored rims, and they're quite light. I know we are out in one home and they've been back ordered, but we're trying to refill the stock. That provides the hierarchy. Dana will talk about the hierarchy of controls. So that gives us layering of protection. And so while we work through introducing more people coming in and out of the home, we will continue to be universally wearing the N95 masks and the cool shades, at least until the end of February. We will reassess it. If this is team members, if the mask is really causing you challenges and issues, connect with your supervisor. As we're ramping down from outbreaks, there's a little bit more capacity. Maybe we can fit test to different styles. There are more than one style, and so we will look at options. But at this time, we just don't feel comfortable stopping all the things at the same time. We're going to gradually decrease.
And if I may add, Jen, too, with our outbreaks as well, many of our residents didn't have the ability to get their boosted dose. It was recommended by public health during our outbreaks to await, and so for their fourth dose, for example. And so it's been somewhat of a significant time in between so the immunity will wane. Our hope is during that time frame too, we'll do those once the outbreak is over in those facilities. And now also in terms of Jen talks about our hierarchy of control, I mean, then we can also take a look at once, vaccine is ahead of PPE. So once we get that higher level, and we do have really high rates, but in terms of our residents who are most vulnerable, we want to boost their immunity, and then we can go to the next hierarchy, which is the PPE. And again, our community spread is still rather high, and so once we get those levels, we'll be able to. PPE is the last level in the hierarchy of control, so we definitely want to maintain that for that period of time.
I'm not sure if we will be able to disclose this one, Jennifer, but were the residents that passed away fully vaccinated? I'm not sure if that's something we can get into. And I also do wonder about the definition of fully vaccinated these days?
Well, there's that, but also because the number is such a small number, I really feel uncomfortable talking about it publicly. It's identifiable information, and I just really want to be respectful of the personal health information of all of our residents, our team members, our DCPs. So I'd really rather not disclose that.
Well, perhaps what we can share is our vaccine rates are somewhere in the neighborhood of 98 to 99%. So in terms of so we can share that vaccine rates or more broadly.
Okay, thank you. I think that's more than fair. If a DCP was exposed to COVID from a coworker but doesn't have it, how many days should they stay away from the home?
It's a good question that I'm hoping Dana.
So I think what we've been doing, and you know, the teams, this is a good call to the home, because you know, with public health not following up on all the positive cases, but rather more the high risk positive cases, somebody may get a phone call, you know, or like as you said, this is a co-worker. So one of the things that we may ask in the call to the home is, so thank you for flagging that could be a risk. So are you you know, fully vaccinated? What was your exposure? So what we look to say, were you a close contact? And so public health determines a close contact as being someone, you know, what's the length of time that you were by that coworker? Was it, you know, 15 minutes or frequent episodes throughout the day? So there is a definition in our case and contact management about what what a close contact is. So a coworker, but maybe they worked in a different department versus one that you were interacting with often, you didn't have PPE on, or maybe, you know, they, and also when they were infectious. So what was their period of communicability? Were you with them but weren't at the office for 5 days and then they developed symptoms, you know, 5 days ago? So this is what we need to assess, and that will help us with their risk. And our team is getting really good at doing this risk assessment. So there's going to be some questions, but really appreciate you recognizing that this could be a potential risk. Get it assessed before we come into the home, and then we can work from there.
That's great. I do see one comment here that is a vote yes for more of those cool shades, Jen. The next question or comment, December 22nd until February 21st is a very long time to be isolated in their rooms. How are programs going to be able to do programs if the auditorium is not available? Residents need stimulation.
Yeah, absolutely. And it is a really long time. And I'm also, I am always impressed with the program teams in all three of the homes. And the Rockwood team, program team, were everywhere doing all the things that they could. They were providing, and all the team members are important, but this question's about recreation and stimulation, and so those team members were helping with in-room meal service, but they were also helping people go for a safe walk down the hallways. There were some ladies that wanted to get outside, so they did it in a safe way. So they sorted out how to do that, how to support people safely when the hallways are clear, and get them outside to see some the sky and some fresh air, down to see the aquarium. I'm quite confident that there was all sorts of singing and kibitzing. Particularly Rockwood has a great TikTok video put together, so they're always doing those. So I am quite confident that even though some residents were in their rooms and never had that opportunity to get out, when staff went in, there was good engagement. So in terms of the auditorium, this is a resourceful crew, and there are other corners and nooks and dining room space and other parts of the home that will be utilized for outside the box ideas. The other thing is the auditorium can be, I'm confident there's a way to have it available to be set up really quickly without it being completely out of commission. So I think that there'll be some way of, even pushing things off to the side and still being able to use some of the space. So I say that having not talked to them at all. And they can only be in groups of 10. So they only need space big enough to have 10 people with safe distancing and masks if tolerated, etc. But I'm fully confident that they will resourcefully find a solution. And they want to do this. Everybody just wants to get as close to back to normal as they can under the circumstances. Oh, Terry Fisher just gave me a big thumbs up on text.
Thanks,
so
Terry.
We're good to go.
All right. The next one here would be coming your way, Jenna. If you have had COVID, do you need a booster?
Yes, actually, we were waiting for the notification and it came and just hot off the press today. So, and yes, if you've had a COVID, certainly you can get a booster. There's a couple of conditions, booster being the third dose, and in some cases, fourth dose for those that are eligible. The conditions are that there must be 84 days in between your last dose. And also it was 30 days post-COVID. So making sure that you're recovered. Now, what the part about hot off the press is NACI's new statement. That's the National Advisory on Immunization, Committee on Immunization. And they have now said that if you've had COVID, to wait 3 months, or you can wait 3 months before you get your booster. And then what the Ministry of Long-Term Care wants is that as soon as you're eligible, if you chose to wait that 3 months for your booster, you have 30 days to get it. So I will work through that if and that is, as I said, hot off the press today. And so we are still going to work through that. Even with our residents, many of them did wait that were positive for COVID. They waited the 30 days because that was the recommendation by the Chief Medical Officer of Health, Dr. Karen Moore, and we provided it for those. Now we do have this new information for NACI saying if you acquired COVID, naturally acquired COVID through an infection, you can wait the 3 months, but need to get that vaccine, that booster, within 30 days to come to the home. And that's that chart that Jen showed you with the 30 days highlighted. So as soon as you've met that eligibility to get your booster. So yes, a booster is definitely recommended, even with a COVID infection.
Okay, thank you. Can residents and a DCP leave the room, walk about in the homes?
Yes. So yes, and the same rules apply. So no congregating, watch your distance, keep your masks on. If the resident can tolerate the mask, that's good too. The residents that have not been in outbreak homes will probably remind you to do some hand sanitizing, because the residents are getting really good at hand sanitizing on their way in and out of the rooms and their way in and out of the dining rooms. But yes, you can.
Right. How long after an outbreak is declared over can a resident go on a day outing?
So we did talk about this at Rockwood, and we're all a little scared, but if the outbreak is declared over tomorrow, which is Friday, then we will implement the new eased restrictions on starting Saturday. So when we send, and we just so that Rockwood folks know, our outbreak management meeting, which has been happening daily and then 3-4 times a week, it's usually at 1:30, and we're actually doing it earlier in the day tomorrow so that we can get the communication out a little bit sooner. So watch for that. And if you do want to take someone out, take a resident out, just a reminder, call the home, talk about what your plans are, and anyone in the vehicle will need to do a rapid test before you go.
Okay, thank you. The library at Rockwood is not accessible. Could books be brought out to the cafeteria or to the floor for residents to choose new books or magazines?
I will take that back. I think that's a great suggestion.
Thank you very much. So just a comment, Dana, it's not just DCPs having trouble with the N95 masks. I have seen PSWs with lines on their faces. Take that comment as well.
Yes, I absolutely. I think that we're not alone. You know, and some of our hospital partners have been since the beginning of the pandemic, who have been wearing the N95s. We absolutely recognize that there are some challenges, and for those individuals, we've worked through, as Jen said, to talk with their supervisor if they are having some challenges, taking more frequent breaks. We can take the N95s off, and you know, we are encouraging all of those recommendations. We've got certain creams that, you know, are able to support the face, but we definitely hope that once we hit the end of this month, that we will be able to be in a place where we won't have to see the lines on their face. And I was in the home today too. I may look a little more haggard, but it definitely, you do get lines on your face, and that definitely shows the tight seal and the ability to keep not only our as a source control, but also protecting our staff. So it's definitely a fine balance. And we recognize, our hope is that we won't be here for forever. You know, we're definitely scaling it down.
I do expect that we, when we scale down from the N95, it will be back to the surgical masks. And I kind of think that there will be a time when people come into the field and they talk to some of us old guys, and they say, "You mean you used to not wear a mask?" Like, I can't even imagine. I think surgical masks are going to be here to stay in healthcare. And I think about how much better it's been in terms of minimizing gastro outbreaks and other things. So I think it improves the quality of experience for people living in a congregate setting.
Okay, we're getting a little bit close to 8 o'clock here, so maybe we'll take 2 more questions and then we will end it there. And then if we don't get to your question, by all means, again, just email communications@grey.ca or reply to one of those emails and we will respond to you. So this one, does the resident need to be rapid tested upon return from a day trip or an appointment or a day absence?
Yes, that directive has been in place since, I don't know when, but yes, they are tested on day 5. So 5 days following the absence. And that's for both overnight when it becomes an option, as well as day trips.
Okay, thank you. Does the driver of the disability van need to be tested when you say that everyone in the vehicle needs to be tested for outings?
I will follow up. I need to follow up on how often that's been, whether people are going out in a disability van, and what our relationship is with them in terms of an agreement. So anybody that fits that category of staff, support services, contract, there's a process in place for them to be meeting our testing requirements. So I just need to follow up on that. I'm not sure.
All right, well, thank you for flagging that possible barrier. We will look into that.
And if I may, we have been in touch with the Voyago and the supervisor at Voyago, and that may not be the van that they're talking about, but certainly we've talked about our expectations, and we've agreed, they recognize that they are supporting our residents, and they want to do everything to keep them safe as well. So we've been really it's been helpful that way.
All right. Well, as it happens, that actually gets us through our question bank. So I do think we got to them all. I don't see anything in the chat. Thank you again, everyone, for joining us tonight. And as always, Jennifer, I will give you the last word for the evening.
Thank you. Yes, I do always like to wrap up. So in closing, we are all tired and done with COVID, but we need to stay the course. There's been so much that has changed that we can be thankful and hopeful about. We have vaccines that reduce the severity of illness for most. We have a good supply of PPE. We have increased access to testing. We have experienced and dedicated team members and designated care partners continuing to show up and give their best. A fellow leader and friend shared a quote with us today. Very little is needed to make a happy life. It is all within yourself, in your way of thinking. So let's focus our thinking towards hope and kindness for ourselves and each other. And thank you so much again for being engaged and being a part with us as we work through this. And have a great evening.